start on parasternal long axis. It's cold, Paul. And my hands are still cold. But remember,
Oh, the screen.
It's not as clear.
This is so sad.
this is the TV your parents watched.
You watched it too.
Yeah.
I remember the black and white TV. Awful. I used to watch TV on that.
Parasternal long axis. You would commit to that.
Ew. It's gonna take you 20 minutes.
There you go.
Like actually.
Commit. Because I'm gonna keep seeing it be blurry and I'm gonna just not commit.
I tried to get my fiance's and I was like, I give up.
Then
Let's
we're
go
gonna
to
turn
the
on
Oh my
color,
You need help.
and you would show color over the mitral valve,
Ew, the color.
and you would do color over. Okay, I just need to make a comment. You might be scanning on a machine like this.
Oh
No.
no.
Okay, depends on where you get a job.
UMC?
No, UMC actually has older versions of a GE, but the older versions of GE look like the older versions of a
Are you
Canon.
going to UMC?
What?
Yeah.
Who are you gonna see about it?
Let us know how it is.
Okay, I was planning on it.
So you're going to do color on the two valves, right? The aortic and the mitral. You can do it both at the same time, or you can do it separately. We're going to make measurements. Get a nice view, freeze it. On this machine, I'm going to go to end diastole. You can probably use dual on the other machine also. I just didn't know where it was. I like to do side by side because then I know what I measured. I'm going to calc LV Teicholz, IVSTD, blood tissue interface to blood tissue interface, diameter, set, to set, posterior wall, set, to set. Make sure you're staying parallel to the structure you're measuring. Then come down here to the diameter and systole and set to set. Okay. Then if you have a good picture, you can do it, or you can just kind of focus over here on the aorta and the left atrium. Again, in diastole. In systole, aortic valve, AO diameter, this is the sinuses. So you're looking for the little cups if you can see them. Leading to leading. And then left atrial diameter, same spot, trailing to leading, or inner to inner. Okay? I can do the same thing. So now I would want to do LV outflow tract. Again, sometimes you have an image that you can do it all at the same time, and if you can, you should take advantage of it, okay? If I want to zoom, I can. I'm not going to zoom too much. Have a nice image. I'm going to scroll to somewhere during systole. It's on the aortic page. It's down here at the bottom. It says LV outflow tract diameter. Anything greater between 18 and 22 would not question your measurement, okay? So now I've done everything I need to do there. I go to RV inflow.
So much easier to find the right things to press in this machine.
The what?
It's easier to find whatever we need to press in this machine.
Oh, that's because you learned it over here. But the other machine does have new imaging technology, so it makes it easier to get crisper pictures. So there, as you would commit, you would turn on to color. If you see the TR, and I know Paul has some, call up your cursor, drop it right through it, go to CW, baseline, scale,
That's what the sound is like that?
I don't hear his like I was hearing, Kyle's. If I hear it, I'll tell you.
Why does it sound like that?
The speakers on the machine.
Trash.
I'm like, wait, it sounds like a lot of TR for me.
No. So I'm just going to pretend that this is TR. I went to tricuspid. I picked TRV max. I'm going to go to the peak and measure it.
Is that AFib?
No, that's not AFib.
60 cycle interference.
60 cycle interference, but it's not AFib. Then I'm going to rotate or angle the other way, and I'm going to pick up the RV outflow. Very nice. Turn on color. Okay, so I won't do the pulse wave here. I'll just do what he's checking you off on. You're going to put your cursor just before the pulmonic valve. Pulse wave. Baseline.
This is pulse wave.
This is pulse wave. You get something you like, then you're going to go to pulmonary valve page, pick PVV trace, pick the peak velocity, and just double set. Now I've done everything there. Any questions on parasternal long axis window? Then I'm going to rotate to the short axis. Again, you could start wherever you want.
For the apex, are you gonna slide down or are you the same?
I actually pulled up on Paul.
Okay. So for Kyle, you didn't.
For Kyle, I probably pulled up a little bit, yeah. But not
No,
like I did
that's
with
fine.
Paul.
I guess it just depends.
I'm going to try to get all the way to the apex. Then I'm going to come to finding that mushroom cap. And then I'm going to come up to the mitral valve. And then I'm going to come up to the aorta.
That's weird. Looks like he has 4 cusps.
Yeah.
Does
It's
he?
only 3. When it's open. I agree. You're seeing a raphe. It's just 3. So you would turn your color on. Color across the aortic valve. Come over here to the tricuspid valve. Color on the tricuspid valve. Cursor. Oops. Maybe I got used to the other machine already. CW. Again, I'm not picking it up, but I would go through the motions, choosing something that would be reasonable. Tricuspid, that's not what I would do in a real study. TRV max. Then I'm gonna roll over here to the pulmonic valve. Call out my cursor just before the valve, pulse wave. thing. It's on the Pulmonic page. PVV trace, go to the peak, double set, or you could just get a caliper, that will work also. Okay. Any questions on the parasternal window at all? Yeah, if you're gonna use Paul for that apex, you're either gonna have to slide down an intercostal space or pull up and look deeper. Okay. You good, Kyle?
Mm-hmm.
All right, apicals. Hold again.
Oh, wait. Look.
It's too dark. I couldn't see it. It's too dark. Can't see nothing.
Your hand hurts?
Mine?
No.
Oh,
Kyle.
No.
mine hurts. I'm in trouble.
You have what? Like 10?
You have 10.
10 more scans today?
Today, well, I won't, but there have been times when I have had them, yes.
Monday?
It's
Like,
Monday.
Mondays are like the
It's
hardest.
Monday.
It's Monday. It's a bad day. Sadie's already there. She should be on number 2 by now. So you're going to get the best image that you can get. Make sure you can see those walls. I'm using my focal position. I'm using my frequency. Came down on the frequency.
Kyle.
Okay. So you're going to get a nice 4-chamber, commit to it. And when you're ready, we're going to freeze. On this machine, I would go to end diastole. I would use dual. And I use dual because when I'm measuring, you know, I know that I'm not foreshortened if my apex isn't dropping down a whole lot. So it just helps me. I like dual. You don't have to use it. Go to Simpson's, 4-chamber diastole. Start at the apex. With your best Etch-a-Sketch skills. I will tell you, the newer machines have auto packages that are very nice, but you still have to be able to correct them when they have the mind of their own. Then I went to systole.
I forgot what it was Simpson. Is that the T?
It's right
Oh,
there.
okay.
Not Tycolds. Tycolds is the other one. Come around. Paul's not normal. I know that's not right.
What is it?
It's measuring 45 right now.
Why is it doing
I was probably a little generous over here.
Poor function Paul.
Or,
We have a Kahoot today, so better think of some names.
Oh god, that Kahoot must be interesting.
5-chamber ball, parasternal ball.
Let's all do PPs.
now I got it. Now you're normal. So the other thing you can do if you have a nice view is you could measure the left atrium in that window, okay? If not, sometimes it is the right window, sometimes it's not. Go get another one. You want to make sure the left atrium is very nice and elongated. I pulled my focal position down there because I want to see it better. Freeze it. I'm going to go to end systole, so right before the valve opens. So on this machine, you're going to go over here to LA volume. I'm going to choose apical 4-chamber. Trace around it. Don't go into the vein. Come back. Pick a length from the middle. Straight back. It'll calculate it when we get to the 2D. So I've done all the 2D stuff I need to do on the 4-chamber on the left side. Now I'm going to turn on my color. Let's start down here in the pulmonary veins. Open up those veins. If I need to dial my color gain up, I can. I can also drop my scale if I needed to. I'm gonna bring my sample volume in, set it right in there.
What should the size be? For
5, 3 to 5 for the veins.
Is everything 3 to 5?
Well, yes. But so he would want you to be probably at 5 for here,
And then like mitral inflow. Would be
and mitral
3.
inflow would be 3.
Is that a
Pulmonary. vein.
Pulmonary veins, so I'm
Oh.
The S and the D.
there they are. Sometimes you have to be patient. Pulmonary vein, I'm going to use S2 on this machine. D. A velocity, and Val's got the same problem Kyle had, but it's probably right there. Okay. Remember, if you need an AR velocity, it'll be there. Trust me. Now we're going to go to tissue Doppler. No, let's not go to, let's go on to color flow at the mitral valve. I'm going to call up my gate. I want my gate size down to be about 3. I will tell you I tend to go even smaller than that, but 3 is what you think. What's odd. I'm being picky. Okay. And you go to mitral valve, E velocity, peak to E. It'll automatically bring up the D cell time, set that. Peak to A. Okay. Now we can go to tissue Doppler. I'm going to come over here to the lateral annulus. Make sure your gate size is at 5. It shows up right here on this machine. Pulse wave. On the mitral page, we're going to use E prime. And he likes A prime. Okay. Then keep the same picture. You can update, make sure you're still good. Roll right over here to the septum, or you can go back to your big picture. Update. E prime again. A prime again. I'm using set to lock it in. Now I'm going to open up that 5 chamber. I'm going to commit to that. I'm going to turn my color on. My cursor, I'm going to drop them right down between the aorta and the mitral. Because I'm trying for IVRT. I'm going to use CW. It's on the mitral page. It's not on the mitral page.
Aortic, right?
Aortic page.
You
No, it should be on mitral.
Oh, there it is. I see. The first one.
No, the big letters. And it's a time from, I'm going to measure this one, it's clear.
Is it from the beginning to
So from the end of flow, when the aortic valve closes, to the beginning of flow when the mitral valve opens.
is what I got wrong in my
Okay. So now while we're still here at the 5 chamber, I'm going to do LV outflow track. So I'm going to put my sample volume right where I measured that diameter. I want to make sure that my gate size is about 3. This is pulse wave. Optimize my flow, my image, tracing. You notice it got smaller. That's because I kind of moved. The farther out you get here, the lower it'll get. You don't want to be that way.
So you want to read just at the tips of the leaflet?
Just before, right where you would have measured the diameter is where you want to be. Okay. Now we're going to go to the aortic page, LV out, flow track, V trace, where it starts. Back around. Then from that same view, now we're going to go to CW. Now you would also do this in the 3-chamber. You would also use the PDOF, but not for these purposes. I adjusted my scale so it was a little bit bigger. Get a view that I like. Aortic valve V trace on the aortic page. Set. So this tells me that my aortic valve area is 2.7, which is perfectly normal, which is a good thing, right? So now we're going to go over here to the right side. Turn on the color. See if we can find Paul's TR again. Call up my cursor. Put it through it. I'm going to use CW. Not really picking it up, but it's on the tricuspid page, TRV max. I'll pretend it's that. Okay.
But that's really just a valve.
Yeah.
Right?
So now while I'm here in this true 4-chamber, I'm going to call up my cursor and do TAPC. Using M mode.
Not too bad.
We'll use a caliper for it, which now I've lost on this machine.
What is caliber here?
Yeah, right.
It's right
There
here.
you go.
Yeah. This is what happens. About halfway through a machine, your brain flips. So I have to relearn it. So I'm going to come down to the trough, go up to the peak. We're good. He's normal. The same view. I'm going to turn on tissue Doppler. I want my sample volume size to be about 5. Gate size is right here. Pulse wave. And then I'm going to use a caliper and measure the peak velocity of that on the S wave, which should be right after the peak QRS in systole. And then finally on the right side, I'm going to rotate a little bit. Really bring in that right side, try to see the whole apex if I can, but I want to keep the whole 4-chamber.
You rotating counterclockwise.
Mm-hmm. I did just a tiny bit. I sometimes shift, but then I freeze it. I'm going to go to end systole. I'm going to use the caliper again. It's a basal measurement. Enter. To enter. 4.1. You're still normal. He likes that. Okay. I'm done with the 4-chamber. I'm done with the 5-chamber. I'm going to rotate to the 2-chamber. When I get it, I would commit to that. There we go. And then take a little breath in for me, Paul. Stop breathing right there. Hold it, hold it, hold it, breathe. So now I'm going to go through the same motions. Dual, diastole on the left, systole on the right. Calc, LV Simpson's 2-chamber diastole. Two-chamber systole. Got a little bit of a shadow there, so I'm having to guess. I have an EF of 51, which is, again, I was probably a little generous here. So the shadow, you see this black line coming right down through there? That's the shadow. Made it a little difficult. Just allow. Be nicer about it. Still 50. It's normal. I'm not going to fret over that. Same thing. I'm going to focus on the left atrium. Going to end systole. LA volume, 2-chamber from the apex. Don't go into the vein, come around, back to the annulus, pick a length, straight back. If I had put in this height and weight, it would have given me an index, which is really what we want. While you're here, you will want to put the color across the mitral valve and the 2-chamber. And then we rotate to the 3. Show that. Color. That's what?
What is that like balls?
That's the right atrium.
It's like the aorta's going into it.
Yeah, see the tricuspid valve? So remember, again, this is not a part of your checkoff, but you will frequently see people throw color over here because sometimes you can see TR and it's in the right angle and you can pick it up. And there it is.
And then you can see it the way.
And there it is. Remember, the tricuspid valve is this big old fluffy tri-leaflet valve, and so any place you can see the tricuspid valve, you go for it. Any questions in the apical views? All right, now we're going to have our patient roll back on their back. Bend your knees. Now, just so y'all know, I'm not standing up because y'all are taping, but I typically do this particular view standing up. It's just easier on my shoulder. Oh, Paul, you're going to make me work.
No.
Take a deep breath in. There it is.
Ooh.
Let it out. Once you find it, okay, so for Paul, you need to definitely make sure you get underneath the side void, okay?
So that is like a 3 o'clock.
So my thumb is the index, so it's at about 3 o'clock,
Okay.
all right? So from here, I'm going to throw
Nice.
color
Nice.
on the atrial septum. Also going to look at color at the tricuspid valve, and I could again do CW. I hear it now.
That's it, right?
Is that TR?
That is.
So back,
What?
those
Yeah.
those bigger ones weren't?
The bigger ones,
Like
Yeah.
this?
so this was probably aortic valve.
How can you differentiate between
The timing. TR is always going to start before the aortic valve, and it's going to end after the aortic valve. And this right here looks like the clicks of the aortic valve.
So if you see TR, it would be around
It would
here.
start more here and come to right here. Yeah.
Oh, you're right. That's
Okay.
what we're learning just now.
I did learn that.
Yeah. Okay? Now, oops, I lost you. Take a deep breath in again for me. Hold it. Now while he's got it held, I'm gonna rotate and pull in. There's your IVC. Sniff, go. Good.
Nice.
Okay? And then I'm gonna angle down. There's the aorta.
He collects 100%.
You can breathe if you have to. Okay, so there's IVC, aorta. IVC dumps into the right atrium. Take a deep breath in again. Yeah, aorta. See it pulsing?
Mhm.
All right. You can breathe. Any questions on that? Got it. And finally, my thumb is the index. It's over here towards his right shoulder. I can tell you Paul's is not going to be as easy as Kyle's was.
But you have the index going towards his right shoulder.
Left shoulder, sorry. My right. It's early.
Okay,
I
okay.
haven't had but one cup of coffee. I'm going to have to stand up for this. Sorry.
Oh.
Whew. Okay, so sometimes I use color to cheat. I'm looking, there it is. All right.
Where it is.
This is the transverse right here.
What is that?
So ascending's gonna come up here. Transverse.
Transverse is like the arch.
Yeah, so the ascending, transverse, descending.
Okay.
Oh, I don't know if I'm gonna be able to get Paul's.
Make sure you tell Dr. Pellet that.
I'll tell him. Paul doesn't have one. Yeah, his is not. What's my phrase? I would not use Paul for this checkoff.
Oh.
I'm just making sure I'm not missing something somewhere. See that flash of blue?
That's the descending.
That's the descending.
Just can't see it.
You just can't see it. You just can't see it on him.
Okay.
And it's just, you know, Paul's heart already sits low.
Uh-huh.
So I'm aiming from here, trying to get down to where his arch is probably here. Instead of on you, your arch is like right there.
Okay.
Okay? That's it.